Cherry TV. The news person? I haven't done her.
No, 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 she's still.
You know her?
2 hour drive. That's outside the road.
Yeah, probably.
Hi there. Hello. On the other side. We'll be in front of Dennis. Hi. Hi. I'm Jonna. Hi. So, yeah, go ahead and set up wherever you need to be. All the action's going to be right here. And then we'll do it right. I'm glad to see everyone this morning. Thank you for coming out and helping us spread the word about this exciting activity today. So let me just give you a rundown of what we're going to do. I'm going to introduce you to a few folks who have led this effort, and then we'll take a tour. You're welcome to do one-on-one interviews if you'd like. If you prefer, you can also just record them from up here, so whatever works for your medium, that's perfectly fine. So I'd like to get it started by welcoming Kevin Harrington. He is the Executive Vice President of Altus Health and President of Altus Emergency Centers. And so Kevin is going to tell us why we're here today. Come on up, Kevin.
Thanks, everybody. So I typically speak kind of low, so if y'all need me to raise my voice, just let me know. So we can start our recording on this. So again, my name is Kevin Harrington. I'm the president of Altus Emergency Centers. We opened up July of last year, and prior to us opening, we visited with CHI here locally with Sean and Monty and Yana, and we started some conversations that were very interesting to us as an organization. And so once we opened up in July, we started seeing a lot of patients here. We got a lot of feedback from these patients, and one of the interesting things that they were asking for is, why don't you accept Medicare? Why don't you accept Medicaid? What's going on with the in-network versus out-of-network billing? And so if you don't know, freestanding emergency centers are not recognized by CMS, that's Medicare and Medicaid. So all the freestanding emergency centers in the market are unable to see the full population here in Lufkin. And one of the things that Altus likes to do is be really partnered with the community, be involved in the community, and listen to the community to find out what their needs are. And so when we brought that to CHI, they were very interested from their strategic plan to be able to have a freestanding ER on this side of town. So we started negotiations with them, and those negotiations went really quick. I counted this morning, it was just about 4 or 5 months that we have been able to bring this together, which is a remarkable time frame to have it work so quickly. So what we were able to do now is partner with CHI for them to come in and utilize their Medicare, Medicaid contracts, their commercial contracts, to where there's no confusion on the billing practices that happen in a freestanding ER. It's very transparent, very clear to the patients, and all patients in the community, be it from grandma to the grandchildren, can come here to this facility, and we take care of all the generations here in the Lufkin community. And we're very happy to do that. We're very proud to be working with such a great organization such as CHI and the leadership that is here locally at CHI. So one of the things that we will be doing is helping them with the day-to-day operations here. So they've engaged us in that agreement. And one of the things we want to ensure is, in a freestanding emergency center, one of the things that patients have come to love about freestanding ERs is that there's a very low wait time. There's one-on-one interactions with the physician and with the patient and the nurses, because the volumes is so significantly lower and the acuity level is so significantly lower than a large hospital ER. And so people have come to like that aspect, and so we're going to continue ensuring that we have really high customer service, low wait times, and good throughput for those patients who do come here. And then we'll also be helping them in some other strategic areas. So very excited to announce this partnership with CHI, and I'm happy to take any questions now or take them later. And I think Yana has either Sean or Monty will come up and speak as well.
Thanks, Kevin. Okay, so yeah, we'll take some questions afterwards. I'm sure you all have a lot to ask. But at this time, I'd like to bring up Monty Bostwick. He is our market president for CHI St. Luke's Health Memorial, and he's going to give us a few words.
morning. Unlike Kevin, I don't speak quite so softly, so you shouldn't have a problem hearing me. Listen, it's a great day for healthcare in our community. This is an exciting time as we get to announce a new partnership with Altus. And I wanted just to briefly talk about our mission. You know, the overriding mission for us is to provide the very best healthcare that we can for our community. And this is yet another resource that we're going to put into play that's going to help us to deliver on that mission. As Kevin said, there's all kinds of reasons and differentiating factors for us with this facility versus other freestanding facilities. I think it's going to create a lot less confusion. And in addition to that, we're also looking to consistently put out more touch points in the community. And this will serve to bolster that strategy and our ambulatory growth strategy as well. So in all facets for us, we're just extremely excited about this opportunity and provide this service for the community. So that's all I have to share. I'm happy to answer other questions after this. But I wanted to have an opportunity to introduce, if Gianna's okay with this, I'm going to go ahead and introduce Sean Barnett. Sean is the Lufkin president and the COO for our system, and has done a vast majority of the legwork with him and Kevin and exchanging documents and negotiating, and he's done a wonderful job in bringing this to fruition. So with that, I'm going to bring up Sean Barnett.
All right, thank you, Monty. So, first thing I would like to do is thank members of my team who did the due diligence on our end of things, and our attorneys up at Houston and Denver. Also want to thank Kevin and his team and Garrett for being really easy to work with. It's been a pleasure to work with their organization and get to know them. They are a quality organization, and I think it's going to be a good fit for both companies. One of the things I just wanted to share is you look at this model that Kevin described and how Monty described it fits into our strategic plan. It's a hospital-based model, and so it's really a department of our facility over there on Frank Street. And so we have an ED over there, we have an ED here now, but that's a different model than what you see in the community right now with the other freestanding EDs. And so with it being hospital-based, it gives us a few benefits that our competition doesn't have. One, it gives us another access point on this side of town, which is very strategic for us. When you look at our existing ED down Frank Street, we see about 34,000 visits a year. It's really difficult for us to grow that with our constraints of facilities. And so this gives us an opportunity with the larger footprint and the second footprint to continue to grow and support our community. Kevin mentioned it before, but now we can see all payers in this particular facility, which is wonderful. Because I know when we first announced our letter of intent a few months ago, I think they said they had 6 or 7 patients that were Medicare and Medicaid come in here thinking the transaction was already completed. And so that just shows the demand on this side of town that's going to occur now that we have this relationship. From a structure standpoint, I want to thank Dr. Allen, who's going to be our medical director. He's our medical director of our current facility in Lufkin and in Livingston, and also will be the medical director of this facility, and today he's working here. But what that will do is it will provide a really good transition of patients if we need to move them from this facility to our Lufkin facility downtown for a higher level of care. And so that transition will be a little smoother than probably it would be since you had 2 separate organizations before. And so with that, I want to thank our staff that's going to be working here. They were previously Altus employees. Now they're going to be Memorial employees, and they've come on board. It's exciting to have you all part of the team, and looking forward to a great relationship. So, any questions for me, or we can?
Do y'all have any quick questions, or if you want to do one-on-ones, we can do that. We're going to do a photo op in front of the banner here, so we're going to go ahead and do that.
Yeah.
Okay.
Sure.
Okay. So, Dr. Allen, Kevin,
Okay.
Garrett, Dan.
Dr. Allen, you get in the middle. You're the big guy.
So we need to scoot together, or so.
There's only so much space.
Yeah.